It's Sunday, December 3rd, 2023. This is What's Going On Central Illinois, the Greater Peoria Public Affairs Program, a weekly check of charitable community events, organizations, and neighborhood goings on with me, Roxy, a production of Cumulus Central Illinois. This morning, we welcome to the show Chris Schaffner. He's the Executive Director for Jolt Harm Reduction. Good morning, Chris.
Good morning, Roxy. How are you?
I'm doing great. Thank you so much for joining me. I know that you are very busy. You've got a lot going on at Jolt, but a lot of people don't know what Jolt is. Can you fill us in on what Jolt is?
Sure, I'd be happy to do that. So Jolt started in 2012, started initially as a Narcan distribution program after the fatal overdose of Dr. Tamara Olt and her husband Blake Olt's 16-year-old son Joshua died from an overdose. Whether or not Josh should have ever used or not is really irrelevant. That was a preventable and reversible experience. The problem is when they called 911, the local rural ambulance squads didn't carry Narcan at the time. So Dr. Olt began a Narcan distribution program out of her home where she was equipping first responders and basically anybody who would have it with Narcan, this life-saving medication. So in 2016, we partnered together. I was working for what used to be the Human Service Center in a substance use treatment program. And we began to partner with her in distributing Narcan across a larger region. And then in 2018, I left that clinical position I was in, and I came to work to run Jolt. And we've been doing that ever since. We've expanded a lot of our services beyond just the overdose prevention to more of a comprehensive harm reduction approach.
So you've said some words that, like, for me, I kind of know what they are, but I think the general public doesn't understand or realize how widespread the need is for Narcan. So help us clarify. First, what is Narcan and what does it do?
Yeah, so Narcan is an opioid overdose reversal medication. It's really simple. When somebody takes a specific amount of an opiate, so that could be a prescription narcotic or pain medication, it could be heroin, it could be fentanyl, or any of the other kind of drugs in that class. If they take too much, it can completely suppress their respiratory system and stop them from breathing, and that's what an overdose is. Narcan, or the generic name naloxone, is a medication that if it's delivered to somebody in enough time, it can supplant those opiates in the receptors that control your breathing, and it can kick those opiates out of those receptors and restart breathing. And so we've been using this medication for a number of years, but it's usually been in a hospital or clinical setting or within a paramedic ambulance squad. But in the last several years, due to the growing overdose crisis across the country, Narcan and naloxone have been made widely available so that we can get it out in the general community to prevent these overdoses.
That's amazing that the difference between life and death can be one medication.
Yes, it is. I've seen it. I've used it multiple times myself. I've seen it bring back people you thought were not going to come back. And then one minute they were completely unresponsive and not breathing. And then the next minute they were sitting upright and talking to you.
Wow. So this is definitely not a glamorous job.
Not at all. It's actually a very challenging job. I'm not trying to murder ourselves, but the amount of vicarious trauma that can occur because of the nature of this work. I mean, we're literally keeping people alive, and there's an emotional toll that can take on your workforce when you're regularly exposed to that. And so it can be difficult, but we have a mantra here is that dead people can't get help, that people can't get better. And so we've got to keep fighting that fight to keep people breathing and alive, just to give them a hope for another day.
That is really, really cool. What goes into, what other services? Because I know I've had some knowledge of what Jolt does, but you do more than just, it's more than just the Narcan and drug abuse now. There's more to it.
Correct. So harm reduction is not a new term. Everybody everywhere practices harm reduction. If you wear a seatbelt, you're reducing your risk of injury if you're in a car accident. If you wear a helmet while you're riding a bicycle or a skateboard, you're reducing the risk of a head injury. If you wear sunscreen when you go outside, you're reducing the risk of harm from the sun. So harm reduction is not anything new. It's just being applied to very high-risk behaviors. Harm reduction has its roots in the AIDS epidemic of the 80s, and then again that grew more during the 90s, and then even more so in recent years due to the overdose epidemic that we're experiencing. So harm reduction starts by, like I said already, let's just keep people alive, right? Nothing else can be done if people are not still alive. So of course, we distribute naloxone and Narcan, but we also provide other harm reduction services. So when you think about the potential harms that a person who uses drugs, a person who is engaged in other high-risk behaviors like maybe sexual behaviors or sex work, or maybe they're down their luck and they're living unsheltered on the streets. There's potential harms people are exposed to. And we just walk alongside these folks and we offer resources to help mitigate some of that harm, right? So think for someone who is injecting drugs, there's a high risk of spreading hepatitis C among people who share drug-using equipment or HIV. So we provide safe using supplies with the intent that they don't ever have to share, and therefore we prevent the spread of those diseases. I know for a lot of folks that's controversial.
Yes.
It sounds like we're encouraging and enabling drug use, and honestly what we're doing is we know that people are going to use drugs regardless, and so let's mitigate the harm. This is a public health and a public safety issue as well. If we can prevent the spread of these diseases, then they not only affect those who are at risk, but it also prevents it from jumping out into the general public as well. So we provide that, but we also provide wound care. People who don't have safe or sterile environments are often at risk for infection or abscesses or nerve damage. And then that drives up the cost of emergency room visits and 911 calls and healthcare, which often is passed on to taxpayers. So we can help mitigate some of that harm with our outreach program. So we have street outreach every day of the week. We serve 5 counties here. Mostly we're concentrated in Peoria, Tazewell, and McLean County. We work with folks who are on street outreach who are unsheltered, folks who are involved in sex work, and people who are using drugs. And we try to link them to resources and equipment and supplies they need to take control of their health again. Beyond that, we also provide free HIV or hepatitis C and STI testing. That is free. And even more recently, we've begun doing drug checking. So we're able to collect samples of illicit street drugs to test what's in the local supply. So we know what harms and adulterants people are facing. And then we can educate them so they can make more informed decisions about what they do. And even more recently, and this is brand new, we haven't even really acknowledged this to the public yet, is we got a new grant to build out a peer recovery navigation program. So these are folks who are in recovery, who have sustained recovery, and they are peers who are working with other folks who are interested in going into treatment or seeking recovery from substance use as well. And they walk alongside them kind of as guides who have walked that path and can help them find their own way as well.
Yeah, they know what's going on. They've been there. They've done that.
Yeah, there's a lot of benefit to working. Our entire program consists of people with lived experience. Every one of us has some type of lived experience around substance use or sex work or homelessness or living with a mental illness diagnosis, and just those of us who have had hardships and have had a measure of overcoming them and some experience in dealing with them. And now we get to take that and pass that on to other folks who might be in our shoes.
That's great. So you mentioned a grant, and I have on my list of questions, how is Jolt funded? How do you continue to work? I know I went on your website, joltfoundation.org, which is wonderful, and you've got a lot of resources here. How is that funded?
Yeah, so most of it right now is funded through state grants. We work with IPHA around our HIV grants. We work with IDPH around the naloxone distribution and our peer recovery. And then we have a very small, not adequate, but a very small harm reduction grant that helps us pay our staff to do harm reduction work in the community. It's always a challenge working with the state in that timeliness and reimbursement, the fiscal realities that our state faces can always impact us. So we rely heavily on community donations. So whether that's from local partners or financial donors in the community or other organizations that underwrite some of the work that we do, we rely very heavily on people's generosity financially and then with in-kind donations as well to support our work. We've got great partners. There are several local churches and other community-based organizations that provide needed resources for our outreach team and for those that we serve. We just had a couple that was homeless 6 months ago. They decided on their own that they'd like to go to treatment. They achieved sobriety, and they're both working full-time now, and they just got their own apartment, but they had nothing to put in that apartment. And when we reached out to our community supporters, they completely furnished that entire apartment from top to bottom. And so that's the kind of generosity we live on from our community, is when we have a need and we put that out there, the community is very responsive.
That's worth celebrating. That's fantastic. Yep. I actually, and we talked to the director of Sophia's Kitchen a few weeks ago, and I volunteer there 1 day a week, and I know we do meals for Jolt, and I love the community collaboration. That is something in doing this program I come across every week, and that gives gives me hope for a better future with the community working together.
Correct. We can get infinitely more done together than we can apart. Unfortunately, so many organizations feel like they're competing against other organizations, whether it be for funding or workforce capacity or marketing and attention. But if we can set all that stuff aside, we actually not only can meet the needs of our consumers, but we actually all thrive in that space together. So I love partners like Sophia's. They've been fantastic. We've been working with them since the beginning of the pandemic. They provide us anywhere from 75 to 100 meals a day that we distribute to people living on the streets. And it's just been a real joy working with Claire and her crew of volunteers down there.
They are pretty special. So if someone were interested in helping out, making a difference, how could they go about that, whether it be monetarily or any potential volunteer opportunities?
Sure. So our website is very easy. It's joltfoundation.org. And if you're interested in supporting us financially, there's a donate button directly on the front page that will take you right to our donation page, and you can support us that way. And that's always welcome and appreciated. If somebody's interested in helping and volunteering, we have lots of different opportunities to do that. We have some one-off events where we need people who can help man a table and provide just some support at local events. They can always just come by the office or call the office or email me directly at joltharmreduction@gmail.com, and I'd love to talk to them about those opportunities. What we really need are people who can commit to regular service, whether it's once a week or once a month. But so much of what we do is built on trust with groups of folks who struggle to trust other people because they've been often hurt or harmed by them. So one of the ways we build trust is by showing up regularly and consistently so they know they can come to depend on us. So when it comes to like outreach and working in the office, we're really looking for people who feel like they can commit for a period of time to a consistent slot so they can build those kinds of relationships that are necessary with our consumers. And I'm more than happy to talk more about that with people individually. But whether that's, 1 day a week on outreach for a couple hours, or once a month you're in the office on a regular day and people come to know you as someone that's familiar and part of this team, we're always happy to take folks like that. And again, if you're a person with some lived experience that you feel like you've overcome and you're interested in utilizing that lived experience for the benefit of others, feel free to reach out. We're more than happy to talk to you about ways to get you plugged into.
One day I was driving down Knoxville and I saw a kid who was either mentally having a breakdown or he was having a drug-induced episode. And I called you guys, and the people that I dealt with were so amazing. And I don't know
that's great to hear.
Yeah, they were like, the compassion is amazing. And he was a young man who obviously needed help. Is that what you recommend people do? Call you?
They always can. Yes, of course. They can always call us. There have been times where if it's a known Jolt client, the law enforcement will call us directly and ask if we can intervene so that they don't have to be caught up in criminal,
That's awesome.
punishment system for something that they're struggling with. So yes, and if it's not something we can handle, we'll defer them, to the correct resources, of course. There's things that we're better suited to do, and there are things that other programs are better suited to do. And we're more than happy to kind of be that in-between person. So if we can address the issue, we're more than happy to. And if it's something outside of our scope of practice, we've got great relationships with local partners that can meet those needs as well.
That's fantastic. Chief Eric is somebody I've interviewed on a fairly regular basis, and the compassion with the Peoria Police Department, it feels like to me it's better than ever. It seems like they're paying attention to the source of some of the problems.
Yeah, I've had many conversations with the chief about this. It's a challenge coordinating all the care. We have great resources available. Many of those programs are understaffed or underfunded, so there's a limit to what they can do. So a lot of people believe, that Peoria is a resource-rich community, and on paper it really is. It's just never that easy to access those resources, and it doesn't always solve the problem right away that someone may be experiencing. So there's always this challenge, and that's why I think communication is just important, right? These organizations that are working together, we can't oversell what we can do, and we need to make sure that we have good relationships, good working relationships with other providers as well, because sometimes it can be a real challenge linking people to actually access the resources that we say we have available. And that's always one of the challenges, I think. So often, a lot of these social problems by default just fall on the lap of law enforcement. And one, I don't think that's fair to them. That's not their job. And two, it's just not, it's funneling people through too many systems to get them to where they need to go. And that can be really discouraging to an individual that's struggling.
Yeah.
You get referred to one source and they go, oh yeah, well, we can't help you. We're going to send you over here. Then they get there and they're like, well, we need this, this, and this. So you got to go here first. And eventually they just give up.
Yeah.
And that's discouraging. So the better collaboration, and you're speaking my language too. Jolt's tagline is Jolt Harm Reduction, serving with kindness and compassion. Any strategy we have for addressing social struggles and challenges, if it's not met first and foremost with compassion and kindness, I'm not sure how helpful it's going to be in the long run. People deserve to be treated kindly, and just because someone's suffering, whether it be at the result of choices they've made or because of structural or systemic harms from other systems that have failed them, they don't deserve anything less than kindness and compassion as a starting point.
Exactly. Addiction is a disease. And when you realize that, the compassion bubbles to the surface.
It certainly should. I say this a lot of times in trainings that I do, that if the American Medical Association identifies addiction or substance use disorder as a disease, then why is it the only disease we treat with the primary intervention being criminal justice?
Yeah.
Right? Like, could you imagine if you were diabetic and you showed up at your doctor's office and your A1C was higher than it should have been, and he threatens to call the police or call your probation officer or sanction you? Like, that would be insane to think about in that context, but that's exactly what we do with substance use.
Chris Schaffner, Executive Director of Jolt Harm Reduction. You and your crew are doing some amazing work. And I have to say, I really want to meet Blue, your Chief Morale Officer.
Yes, you should come by and see Blue.
Blue is a rescue pup, and I read his story, and now I need to be friends with Blue. So I will be stopping by.
Okay.
Jolt Harm Reduction on Sheridan Road, 2203 North Sheridan Road. You can find them on the interweb at joltfoundation.org. They also have a fantastic Facebook page. Chris, thank you so much for all the work that you guys are doing over there. I will send everyone to donate and volunteer.
Great. Thanks, Roxy. Thank you so much.
This was What's Going On Central Illinois, the Greater Peoria Public Affairs Program, a weekly check of charitable community events, organizations, and neighborhood goings-on with me, Roxy, a production of Cumulus Central Illinois. Thank you so much for listening. Now get out there and make some beautiful memories and do your best to be kind to all kinds. That, my friends, doesn't cost a thing.